Welcome to my channel, Brainies. In today's video, I'm going to deliver the content about the topic Raynaud'S disease. Raynaud'S disease, it's also known as Raynaud's phenomenon. It's a condition where the cold temperatures or extreme stress can cause the blood vessels in the extremities to narrow down excessively, thereby reducing the blood flow and leads to color changes in the skin, initially white, then blue, and then to red. It also causes numbness, tingling sensation, and pain. This is a picture depicting the Raynaud's phenomenon. So the causes of Raynaud's disease are: there are two types of Raynaud's disease, primary Raynaud's disease and the secondary Raynaud's disease. The primary type, there is no underlying medical cause. It's the most common type and it usually affects the women aged 15 to 30 years. The secondary Raynaud's disease, which is also known as secondary Raynaud's phenomenon, it's triggered by the underlying following condition. First, it is the connective tissue diseases like scleroderma, lupus erythematosus, rheumatoid arthritis, Sjogren's syndrome. Occupational injuries like the repetitive actions like typing, piano playing, keyboard playing, or the prolonged use of vibrating tools like jackhammers could be the underlying causes. The medications like beta blockers, migraine drugs, decongestants like pseudoepinephrine, chemotherapies. Other factors are the carpal tunnel syndromes, the thyroid disorders, the pulmonary hypertension, or even the smoking or the nicotine. The common triggers for both the types, that is the primary type as well as the secondary type. The cold temperatures like the cold water or the cold air. The sudden temperature changes like for example AC in the building. Emotional stress, anxiety or excitement. Cigarettes, caffeine and alcohol. Mechanism, the trigger factor, that is the cold or stress can stimulate the nerves and it leads to vasospasm, that is the small arteries in the extremities overreact, thereby narrowing dramatically, leading to vasoconstriction. So as a result, the blood flow cuts off. The limited blood flow causes the color changes, first white, then to blue, and then to red. The symptoms caused are the numbness, the tingling sensation, pain as the blood returns. The symptoms during an attack, the white, the pallor, blood vessels constrict, cutting off the blood supply. The blue color is due to cyanosis, tissues use up oxygen, making the skin blue. The red rubor, blood vessels reopen and the blood rushes back in, causing throbbing, tingling, and the pain. So the clinical manifestations are the triphasic color changes. The affected skin usually turns white, pale, that is blanching, due to the lack of blood flow, and then turns to blues, that is the cyanosis, due to the lack of oxygen, and then finally turns red, erythematous, as the blood flow returns. The sensory changes are the affected areas often feel numb, cold, and prickly. So the pain sensation, it is a sort of a throbbing, stinging or burning pain may occur when the area warms up and the blood flow is restored. The localized impact could be it primarily affects the fingers and toes, but it can also involve the nose, ears, lips, or even nipples. The variable durations are the attacks can last from a few minutes to several hours. So the management of Raynaud's disease, it mainly focuses on the lifestyle changes like keeping warm, avoiding the trigger factors, and regular exercising with prescribed medications like calcium channel blockers, which is used if the symptoms persist, while the severe cases might need specialized treatments with a key intention goal to prevent the digital ulcers and the gangrene. The lifestyle and avoidance are as follows: stay warm, layer clothing, wear gloves, warm socks, use hand warmers, and avoid sudden temperature changes. Quit smoking. Smoking constricts the blood vessels and worsens the symptoms, so it is better to quit smoking, or at least to reduce smoking. So it's better to limit the caffeine and the alcohol, reduce intake of coffee, tea, chocolates, and cola, as caffeine can trigger the attacks. To manage stress, it's beneficial to practice the relaxation techniques like yoga, deep breathing exercises, as stress can provoke the Raynaud's attacks. It's good to exercise regularly, as exercising regularly can improve the circulation and helps to manage stress. Protect hands. It's better to wear the insulated gloves in cold weather, avoid touching the cold surfaces, and use warm water to warm hands during the attack. To warm up, get to a warmer spot, wiggle fingers, toes, rub hands, or place them in warm but not hot water or armpits. Gentle movement. Perform the swing arm exercises, that is, the rotating arms in wider circles. So that's it with my video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.